Welcome to The Explainer. Today, we're taking a truly fascinating journey, but not across the globe. No, we're diving straight into the hidden pathways of the human body. Have you ever popped a pill and wondered what actually happens next? It isn't just a straight shot to your headache or your sore back. There is this complex, totally unseen obstacle course your medication literally has to survive before it can even begin to do its job. Okay, let's dive into this, because the answer to this question completely changes how modern medicine actually works. Why on earth would a doctor tell you to let a tiny pill dissolve under your tongue instead of just, swallowing it with a glass of water? Well, it turns out the route of administration drastically alters how effective a medicine is. And understanding exactly why that happens comes down to a crucial biological checkpoint that every single oral medication has to face. To figure this out, we're going to follow a clear roadmap today. We'll start with the definition and core concept, then look at natural variations in metabolism, check out the clinical significance in dosing, uncover some clever medical workarounds to bypass this effect, and finally, wrap up with healthcare team monitoring.
Let's jump right into section 1, definition and core concept, or what I really like to call the body's toll booth.
So here is our formal definition. The first pass effect is a pharmacological phenomenon where a medication undergoes metabolism at a specific location, decreasing the active drug's concentration before systemic circulation. Right, but what does that actually mean for us? Think of your body as having a heavy-duty toll booth. When you swallow a pill, your body doesn't just let it freely circulate. No way. Instead, metabolically active tissues, most notably the liver, but also your lungs, your blood vessels, and your gut, act as literal toll collectors. They prematurely break down the medication, taking a massive cut of the active drug before it can ever reach the spot where you actually need it. Let's move to and see how this builds across the timeline of ingestion. Here's the chronological obstacle course an oral drug has to run. Step 1, you swallow the pill, it hits your gastrointestinal tract, and almost immediately it's attacked by enzymes. Step 2, the drug gets absorbed and is routed directly to the major metabolizing organs, usually the liver or the lungs. And guys, this is where the heaviest toll is collected. Finally, step 3, whatever tiny amount of active drug actually managed to survive that intense metabolic gauntlet is finally released into your systemic circulation to do its job. Which perfectly transitions us to section 2, natural variations in metabolism. Because as structured as that pathway seems, it is incredibly unique to you. That toll booth, it operates differently for literally everyone. The extent to which you experience this first-pass effect is driven by a highly specific set of biological variables. Things like your plasma protein concentrations, your gastrointestinal motility, which is basically just how fast things move through your system, and your unique enzymatic activity all play a massive role. Plus, research shows this effect actually changes based on your age and gender. So a pill that works perfectly for a 20-year-old guy might be metabolized completely differently in a 60-year-old woman. And that is exactly why personalized dosing is an absolute must. And that brings us to section 3, clinical significance and dosing. When we look at this in a real clinical setting, it truly becomes a high-stakes numbers game. To ground this science in reality, let's look at some drugs that get hit really hard by the first-pass effect. We're talking about alpranolol, the chemotherapy drug 5-fluorouracil, heavy painkillers like morphine and pentazocine, and the immunosuppressant mercaptopurine. Because your body's toll booth recognizes and breaks down these specific molecules so aggressively, a doctor can't just hand over a standard pill and call it a day. And this brilliantly illustrates how healthcare providers actually have to beat this metabolic obstacle. When given orally, those drugs we just talked about are metabolized so incredibly fast that the oral dose needs to be massively larger compared to an intravenous dose. An IV puts the medication right into your systemic circulation, completely skipping that gut and liver toll booth. If a doc tried to give you that tiny IV dose in an oral pill, the first pass effect would totally destroy it before you felt any relief whatsoever. It also messes with timing, meaning an oral pill might hit its peak concentration way earlier than an injected dose would. All right, on to section 4, bypassing the first pass effect. Sometimes your body's filters are just too aggressive, or the medical need is simply too urgent to rely on giant oral doses. So medicine uses some brilliant workarounds. Let's look at a classic example, treating acute chest pain or angina. Take sublingual nitroglycerin. Because it has high lipid solubility, putting it right under your tongue lets it completely bypass the first pass effect. It hits your systemic circulation instantly for rapid relief. Contrast that with oral isosorbide mononitrate or ISMN. Now, ISMN survives the gut and liver quite well when swallowed. It has a minimal first pass effect and high bioavailability, but traveling all the way through the digestive tract takes time.
It's way too slow for someone in the middle of a sudden angina attack.
Here's another really high-stakes example where alternative routes are absolute lifesavers. When children have febrile seizures, seizures triggered by a spiking fever, they need immediate relief. Administering diazepam rectally powerfully bypasses that first-pass metabolism. This ensures incredibly rapid relief, which is absolutely vital in a pre-hospital setting. We're talking before the ambulance even pulls up to the house.
What's really interesting about this slide is that sometimes, instead of changing the route entirely, doctors will literally send a second drug in as a metabolic shield. If you take dextromethorphan alone, it acts as a substrate for a specific enzyme and undergoes huge first-pass bioinactivation. You get a super low systemic concentration. But, and here's the clever part, if you combine it with just a minimal dose of quinidine, the quinidine actively inhibits that first-pass metabolism. It actually blocks the toll booth. This shoots the systemic concentration of the active drug right up. It's an FDA-approved trick for managing a neurological condition called the pseudobulvar effect.
Finally, let's explore Section 5, Healthcare Team Monitoring. Because managing these powerful variables, it's definitely not a solo gig. It takes a whole team to keep you safe.
Since the first pass effect is so wildly different from person to person, there's a golden rule here. You literally cannot just guess. Research shows that actively monitoring patient blood concentrations is the absolute best, most viable way to maintain therapeutic windows for these drugs. It's how we make sure the drug levels stay perfectly within that safe, effective sweet spot.
And keeping it in that sweet spot requires serious teamwork and open communication. Physicians apply basic pharmacokinetics to prescribe the right route and dose based on your unique biology. Pharmacists then step in. They double-check the math and run rigorous interaction checks, looking out for combinations that might unexpectedly block or boost that first-pass effect. And finally, nurses are right there on the front lines, monitoring for any adverse reactions and tracking if the treatment is actually working. That whole chain of communication is what optimizes your outcome and keeps adverse events to a minimum.
So, the crucial point is, the medicine you take is literally only as effective as the journey it survives inside your body. The body's toll booth works relentlessly, and every little detail, from your age to your unique enzymes, dictates the final outcome. Which leaves us with a pretty fascinating thought. Next time you take a medication, whether you swallow it with water or let it melt under your tongue, how exactly might your body's completely unique metabolism be secretly altering its journey? Thanks for exploring this with me today on The Explainer. Keep asking questions, and I'll catch you next time.